So hello everyone. So I'm here to talk about our project, Healthy Learning. My name is Aubrey Bikar, and I'm here with Shannon Fearday and Allison McKay. And so what we were tasked with was to configure and implement the learning management system, Moodle, to help improve access to reusable, standardized, and interactive health education materials for healthcare workers, and so that it will result in improving quality of care inside hospitals. And so we use a 6-step process in both to implement this learning management system at the hospitals we worked at. So first was planning to try to figure out exactly what needs need to be filled, configuration of the elements of the learning management system, testing both at the US through sending remote scripts and testing on site. Try to figure out how to integrate the learning management system into the hospital workflow, and then most of our bulk of our work in India was training, and then using the results of our training and observations to further refine how best LMS could fit into the hospital needs. And so our clients, we had 2 clients, both are hospitals based out of headquartered in Chennai and have hospitals in Tamil Nadu. So our first client was the Sundar Medical Foundations. So they are a widely established hospital. They've been, from the past 20 years, they have a strong teaching institution. They do have strong postgraduate training and also some undergraduate training as well. The second hospital we worked with was BO Hospitals. They are less than 5 years old. They have 7 units scattered around Tamil Nadu in various rural areas. They are rapidly expanding, and then they really wanted to use a learning management system to help deliver training across all of their units. And at Sundar Medical Foundation, they really wanted to be able to use this LMS to standardize training across different departments as well. So here, Shannon will talk about our process.
Okay. Hi, everyone. I'm here to talk about what we did when we were on the ground in Chennai. So we started out with having a lot of meetings with our stakeholders, almost daily meetings, to make sure we were going in the right direction, and we were finding solutions for the problems that arose while we were there. One of the big things that we did was we did training on our LMS. And so what that Hello? Okay. So what that looked like is we had 5 training sessions that we wanted everyone to attend, and they were each 2 hours long. And during that time period, we walked people through how to use the learning management system so they could kind of get acclimated to it, and so then they could go and use it in the future. We did a lot of hands-on training, and we provided support to them. And then this training course that we created is actually in Moodle, the system that they have, and so that they can use it to teach people in the future. They can teach future content creators, and they can also teach future learners how to use the system. Then we went back after we taught them how to use it, and we got some feedback from them. We did some observations to figure out what went well, what didn't go well, what we needed to improve upon. And these insights helped us to figure out what the roadblocks were going forward so we could help find solutions. And one of those was creating these roadmaps. And what these did is it helped people in the areas that they were having trouble and help them walk them through these difficult processes and help ease that learning curve to make it a little bit so people would go and actually use the system and not become frustrated with it. We also trained the IT staff to help support Moodle. So we had quite a few meetings with them to make sure they could back up the system, create new users, and various other important things. We used software called Camtasia, which is, we're actually using that right now. And what it is it's a video capturing and editing software. And we taught them how to use this. And what we thought that they would use it for is they do a lot of education right now, but what they don't do is, or what they do is right now is they only capture it, or the only people that get to see it are the people who show up to the classes. But they already have this material. They already did the PowerPoints. They're already presenting it. And what this allows them to do is capture that lecture that they are talking to, and they can put it on Moodle. So it allows for more people to see that information, which is very crucial. We also provided insights on the best way to structure classes within Moodle. Right now they have a lot of in-classroom based training, so we went through and talked with them about the best ways to transition from in-classroom to online education and how to structure it in Moodle. And then we used Moodle to present in-classroom nurse training. This is one of my favorite parts at SMF. What we did is we had taught the nurses how to use Moodle and how to put content in there. And what one of the nurse educators did is she put the content in there and then taught a class to 30 people using Moodle. And since you only have 30 people showing up and there's hundreds of nurses that are there, then the people who are not able to make it to the presentation, they could go online and see it. So right now we don't have as many people as we would like on the site, but one of our super users missed the training and she was really excited that she could go on the system and learn about trach care, which is something she does a lot, but unfortunately she actually missed the training. So it was really exciting to see that. So here's a little snapshot of the learning management system, Moodle. You can see we have different blocks of information up here. Here's one that talking about the progress that students have throughout a course. You can message your teacher in the system. There's a bunch of really neat features that we found people were using. Here we did some brainstorming about user experience and kind of the roadblocks we found and what we are going to do about them moving forward. And then I'm going to talk a little bit about our other hospital, Be Well. And so there were some things that we did very similar and other things that we changed up a little bit. So we had an initial meeting with the management to determine the best workflow for the LMS with them. So they have that one main hospital but they have a bunch of satellite hospitals. And so right now they were concerned that people weren't getting enough training. And so what they decided to do is the way that they were going to implement the learning management system and implement the change management strategy was they were going to have 2 content creators. They were going to create all the content in the system, and then they were going to we went through and we taught people how to facilitate the courses. So you had people creating content and then people teaching other people about the content that was already created. And so that was kind of the way that they wanted to start out using the system, and slowly they're going to get all the employees on there. But they wanted to start out slowly. So again, for them, we had meetings with the stakeholders. We had used user feedback to help improve what the system looked like, where we should put certain quick links on there to make it easy for the facilitators to get on the system and teach the learners how to use it. So they were doing the content creators, facilitators would teach a big classroom full of people. And what they were hoping then is that once the end learner saw that all the content was in the system, that they would want to get on the system. Versus us forcing it onto them, they would be asking, because they would know, oh, this is really cool, I've seen other people do it. It'd be really nice if I could get on there myself. We also created some custom reports for them so that the course creators could watch what the facilitators are doing, as well as watch what the learners are doing, and get quick, easy information so they can monitor if the facilitators are effective or if something needs to change. Along with this, so we had them create one course, and they went out into the field and actually watched the facilitators teach one of those courses. And during that time, they kind of figured out what might need to be changed to make the system a little bit more effective and make sure the facilitators taught the course effectively. And one of the things that they noticed was that going from a system where it's just in classrooms to an online system, that you really need to make sure you have a script with it. And make sure you detail, okay, this is where you stop, this is where you ask questions. And that was a really cool realization for us, because we had been doing that, but having them realize that you need to change the model of teaching when you go to an online system, it was really neat to watch them realize that and then them transition to a system that required more, active learning, and the facilitators actually getting on there and having to teach a course that they maybe didn't create themselves. Okay. Here's a picture of one of the doctors going through and facilitating one of the courses. And then here is a picture of the Be Well Hospital's learning management system. It looks somewhat similar to the other one. You have the main homepage. You have some custom reports down here. This is inside the course that they taught, the infection control course. And that's, again, another picture of that as well. So I'm going to hand this over to Allison, and she is going to talk to you guys about our project results.
Thank you. So as Shannon mentioned, we work with 2 hospitals who had 2 completely different use cases. They started off kind of similar, is that they wanted to improve quality at the hospital's quality of care by standardizing the delivery of training to everyone. But when we dug in deeper, and especially when we got on the ground, we realized that they were going to do something entirely different. Be Well has 7-unit hospitals all over the state, and their main driving factor here is they need to deliver training at all of these, and they can't just go to every facility every day. It's impossible. They've been visiting maybe 1 clinic or 1 unit once a month. And so if you have 7 units, you're saying maybe 1 hospital, maybe it gets just 1 visit of training a year. So the ability to deliver more training is a huge driving factor there. And at SMF, the big thing there is they deliver a lot of training and they want to make it more accessible. So how can we take advantage of the, large amount of training that's already gone and just make it even more accessible to everyone at the hospital. So I'm going to just talk about some of the project results there, sort of combined, that we had at both hospitals. So the 2 screenshots that Shannon just showed are 2, it's the Moodle, same system, but delivered completely different. So at Be Well, it's configured so that someone comes in as a facilitator and teaches a course that has been designed centrally by the quality team in Chennai. And they're coming up with all the course content, they're delivering it, and they're saying, okay, you people at each of these units, you're going to deliver this course, right? And at SMF, it's very different. Each department is going to have team members working on the LMS who's going to come up with their own content to be delivered largely for, staff within that department, but you could expand it. And so it's working not from a central location at all. And some of these are going to be quite topical to the care being delivered by each department, or they could be more broad. So very different use case. And also for SMF, it's intended for an end user to log in and look at their account and do their own, online learning, versus the other one is right now being delivered through the learning management system. Another big result we had is educating our system users. And so at SMF, this is through our hands-on training. And a lot of times we would have one-on-one training sessions with people, or they would come to us with specific questions. And we had a quite active discussion back and forth there. And at Be Well, again, we had this, we actually trained the quality team who's delivering all the content very intensely. So we had these intense, workshops similar to how education did. They had their instructors come in and work through everything on the system to figure that out. For our UX-based improvements, this was largely a process of working with the end users during their training and figuring out where they were already struggling during training and what we could do to improve it. And then we held a demo day where we invited everyone who had created their course to come in and walk us through their course, talk to us about what challenges they faced, what they liked, what they found easy, and how they overcame challenges. And so this was a discussion between ourselves as well as all of the LMS, involved parties at SMF to sort of talk about what's going on, what worked well. And it was a good discussion where you found that a lot of the people involved who worked collaboratively were able to overcome some of the initial challenges. And so we found that was a big, what's the best word? Helpful. It was helpful if people worked together on it. Also, it was really helpful for moving the blocks around, sort of thing. And that's where these LMS process maps came in, the roadmaps that Shannon mentioned. They were very task-oriented, like workflows. So you start at the top, and you'll end up somewhere at the bottom based on the decisions you make. And if you've ever worked with Moodle, you'll realize that this comes in very handy because it's a very complex system with, I'd say, 1 million options to choose from. So this sort of walks you through that in a way that makes sense from a non-system perspective. And then we've also left behind this course to train the future users of the system for both delivering and creating content, as well as how to be a learner in the system. So one of those is quite extensive. It's that 5-session training that the SMF, trainers can now train other people, and they can grow the LMS within the hospital itself. And this here, for increased training, this one is huge, especially at Be Well. Like we said, they've already been able to deliver this infection control training at 3 different locations within, the past 6 weeks that we've been there, right? So that's a change from 1 training a month for like 1 unit to 3 in 1 month at 3 different locations, right? And it involved, I think, they traveled twice because the travel costs are huge. You're talking about one of the quality members is actually a physician at SMF Hospital, which is how the partnership works. So his time is quite limited. And so now he's able to extend his reach and work with all of these hospitals. And same thing for at SMF, like was mentioned previously, one of the nurses was able to attend one of their CNEs, so their continuing nursing education programs, because she was absent. So you're seeing an increase there of training in different ways that's incredibly valuable, especially at BUL. I think they stand to benefit initially from that sort of like time. They're going to have more time to deliver training, and also the reduced financial costs of delivering training in this large state. So. And then of course we have a knowledgeable IT staff. At BUL you've got one person who's taken over the role here who is really excellent and has taken to the system, customizing it. And then at SMF we had a really interesting, I guess a surprise, because we didn't anticipate the IT team being really willing to take over the role of supporting Moodle, but they ended up doing it. And we had large discussions with them, a few of them, going through every aspect. And something interesting that came out of it is they wanted to use LMS not just to support it, but to deliver courses. So they ended up creating their own a tech course on SQL within the LMS during the training. So I think that was a surprising thing. We didn't anticipate health education actually including IT at all. So, but it makes a lot of sense if you think about it, because within the hospital, they're the people sitting at the computer all day who have the time that's really valuable. So I think that was a very interesting surprise there. And then we had these provided suggestions for moving forward. So this past week, we had a big meeting at SMF with all of our users where we talked to them and got their input on their experience, and then we provided what we saw as suggestions on how to move this forward. One of the big things being they needed to figure out a way to supplement the lack of time that everyone was facing. So time was noted as the biggest thing, sort of as a roadblock. And so SMF is looking into hiring someone to support the creation of content within the LMS, because that's the big thing. All of these people, you've got physicians teaching classes, but they don't necessarily have the time to put it into Moodle. So they want to bring in a resource that can sort of fill that gap, because everyone is keen on the system, but they're just sort of I don't know when I'm going to do it or how I'm going to do it. And there are some possibilities there. And so we had a great discussion with them, and the director came in and was very supportive. So hopefully those suggestions will be taken up and moved forward. So just kind of looking at the numbers here, for SMF, we had 17 learner badges earned, which these were 17 people who have completed the training up to a learner. And we used the Moodle badging system to sort of incentivize them within the system. We had a total of 25 active users during our time there, so anyone who logged in. And I think we had something like 40 people we tried to reach, and we sort of cast a wide net and got the people who are really interested. So of these, these are considered our super users who are going to grow the system from within the hospital. We had a total of 26 courses created within the system. So that is initialized courses. So these users went on to create different courses. Some people created more than one. Some people worked together to create one. So these aren't just a one-to-one number. And then we spent 43.5 hours training. So a lot of training time, a lot of training time. A lot of this is due to the sort of the scheduling constraints of working within a hospital and getting people available at the same time, which meant we were very flexible in our time as well. And so at SMF, we were able to complete a pre and post survey of the LMS experience. And so we just sort of, this is the factor after the LMS. What we looked at is one thing that we didn't necessarily consider as being a huge roadblock, what we did, but we didn't realize so much, was that people wanted to access it from home. They wanted offline access because they didn't have access to the computer in the hospital or weren't able to find the time to do it. And the other one is time. So time and access being huge barriers. So our challenges was how do you even create a course online was a big one, and then finding the time. And our pre-survey also mentioned time as being the most, the biggest challenge to actually delivering training at SMF to begin with. So I think time is just one of those constraints that they're dealing with already. So for BUL, we have a slightly different setup here. We trained 30 of their staff members from 7 different hospital units, and they've actually created a curriculum that's complete of 86 courses. Not yet in Moodle, but they have structured it in a way that maps to Moodle. So they've got a course and a category and the users who are going to go into each thing, and they're ready to go. And so they're looking to build out 2 of these courses a month for the next year and then track it. And they're also going to be implementing their own surveys of their users to sort of get baseline data as they move forward. And then, so our learnings, one huge thing, flexibility is essential. The use case, the implementation at each hospital sort of shifted. We thought we had a clear idea that SMF was going to come in strong and that we were going to get learners onto the system. It ended up we worked only with instructors, people delivering course content. At BeWell, they had the same idea, and actually no one's going to be using it as an end user except for people delivering the training. This learning here about receptive to new technology, I think within health IT, there's sort of like something floating around that people don't want to take on new technology because they see it as like extra work. And at SMF, people were receptive to it, but you also had to show them the value. So we had a lot of people showing up, a lot of people supporting it, people saying in our post survey that they would recommend the LMS to another hospital, but they all were like a little bit hesitant. So they were receptive, but they still needed like that added push of like, how is this going to really help me? I need that extra support. And then this other big learning is this idea of a large versus a small health system. So BeWell was able to kind of achieve a little bit more, I would say, because they're smaller and they could pivot and they could change and they can make things happen. Where BeWell or SMF is a larger organization that was completely siloed, and you had like 9 different departments moving in different directions at the same time without someone sort of wrangling them at the top. And so you needed, I think, stronger sort of structure around that to move them, and it takes longer. Larger organizations just take longer to move forward. And so the last learning here is this pedagogy, the different type of pedagogy that you have to deal with when you're moving from like classroom-based training and delivering of content to e-based learning. You can't just take the PowerPoint that you present here and put it in Moodle and say, go learn. It's not going to work. You need a narrative. You need the objectives. You need all of the structure around it that you get in the classroom online. And you also have to think about the fact that people are going through it on their own. So you need to provide sort of that motivation, those things that are going to move people through your course. And so that is one of the huge learnings there. And so just to sort of summarize, we worked for 6 weeks training, doing a lot of training, working with users at both hospitals to create experts on this LMS, as well as have expert support from our IT so that they can grow this and customize it as they need to do it. We've left these process workflows that sort of guide people through the LMS, and then we also left behind sort of our suggestions on how to grow this, both sort of like the community support for the LMS within the hospitals, as well as how to grow it from a technical perspective and add that larger amount of content. So, thank you. Oh, that's us.
Again, we have time for just one quick question.
What was the greatest challenge in getting, I guess, working with your organizations and maybe getting buy-in from them?
The greatest challenge?
Yeah. Yes.
You guys want to answer? Aubrey's going to answer. No? You know, the greatest challenge, I think, has to be time. So at SMF, I think we felt a lot of people were like, yes, I'm really interested, but I can't do this now. I don't know when I'm going to fit this into my day. One, to even come to training. I can't even come to your training, so how can I even figure out how to use this system? And that was like the biggest challenge. I mean, yeah, that, and it was new. And people wanted to like know that it was going to be around, and they wanted to see that like it was worth their effort. So I felt like people were kind of like hovering around, waiting to see what happened. And I think our partners sort of mentioned that too. They're like, see, everyone's showing up because they're interested, but they're not sure yet. And so the people who were able to attend our training, yeah. So there's, did you want to add anything? Sure.
Okay, so thanks very much.
Yeah.
This brings us to the last presentation